Hello viewers, welcome to the Learners Nursing classes. Welcome back after a long gap. There were some issues with the channel, so we were not able to upload the videos. Now today's the class is about pharmacology nursing and pharmacology. So this will help the pharma students as well as the nursing students for the competitive exams. These are very basic pharmacological questions which we will solve first, and we will make part 1, part 2, part 3, part 4 like that, so that we can cover the whole pharmacology and student can grasp knowledge related to specific subject. So let us start. The science which deals with the drugs and their action on human body is called pharmacology. The study of absorption, distribution, metabolism and excretion of drug is known as, the options are pharmacy, pharmacokinetics, pharmacodynamics and pharmacopoeia. So what is the answer? Pharmacokinetics. The science which is concerned with the study of mechanism of action of drug and pharmacological effects produced on a human body is known as, the options are pharmacokinetics, toxicology, pharmacology and pharmacodynamics. So answer is pharmacodynamics. The substance produced by or derived from a living organism that are used to kill bacteria or prevent their multiplication is called as antibiotics, antidotes, hormones, enzymes. So see, the substance produced by or derived from a living organism, that is antibiotic. Drugs are excreted from the body through, there is always an elimination track of any drug. So drugs are excreted from the body through kidney, breast milk, saliva, sweat and bile, intestine, or the all above. So what is the answer? All of the above. So drugs are excreted through kidney, breast milk, saliva, sweat and bile and intestine. So answer is all above. Which of the following is a source for obtaining drugs? See, animal and plants, microorganisms, synthetic origin, all of the above. See, following are the sources of obtaining drugs. So what is the answer? All above. So sources are animals and plants, microorganisms, synthetic origin. So the answer is all above. The rate of absorption of drug is affected by, जो दवाई जो हमारी बॉडी में absorb हो रही है, that rate is affected by the route of drugs administration, the solubility of the drug, the site of administration, or all above. So you see, the answer will be all above, because route of drug also important, solubility of the drug also important, site of administration also important. So answer is all above. Putting a drug in a liquid form into a body cavity or a body orifice is known as inhalation, solubility of the drug, insertion, or insufflation. So putting a drug in liquid form into a body cavity or body orifice is known as solubility of the drug. The application of the drug to the skin usually by a friction is known as, the application of drug to the skin usually by friction is known as, when we do the topical application, what is it called? Insertion, insufflation, instillation, inuction. See, the answer is inuction. नाइट्रोग्लिसरीन इज एडमिनिस्ट्रेड बाय विच रूट? देखो, नाइट्रोग्लिसरीन जो हम देते हैं वो किस रूट से एडमिनिस्टर होती है? बाय सबलिंगुअल रूट, बाय इनहेलेशन, बाय पेरेंट्रल रूट, बाय इंजर्शन. सी, व्हेनेवर वी गिव नाइट्रोग्लिसरीन वी से ना, गिव नाइट्रोग्लिसरीन सबलिंगुअल, जीभ के नीचे रखनी है, सो दैट इट इज अब्जॉर्ब सबलिंगुअली, सो दैट द कॉर्नरीज डायलेट. तो आंसर इज सबलिंगुअल रूट. When the drug is introduced in the bone marrow, this route is called as what? Intraperitoneal, intrathecal, intramedullary, or intraarterial? See, the answer is intramedullary. Whenever the drug is introduced into the bone cavity, bone marrow, it is called as intramedullary insertion of the drug. When the medicine is administered into the spinal cavity, this is known as intrathecal, intraosseous, intraperitoneal, intracardiac. See, this route is called as intrathecal. Whenever any drug is given in the spinal cavity, it is called as intrathecal route. test dose of penicillin is administered by which of the following route? See, penicillin drugs and derivatives of penicillin, we are always supposed to give the test dose. But we say that test dose we give antigen sensitivity test. Now, administered by which of the following? Subcutaneous, intravenous, intramuscular, or intradermal? Here the answer is intradermal. We give intradermal antigen sensitivity test. We write the name of the drug, we write the time of the drug, and where we have given the intradermal injection. वो जो एक बल्बस सी फॉर्म हो जाती है जब आप इंजेक्शन देते हो तो स्किन के ऊपर आप उसको सर्कल भी करते हो टू आइडेंटिफाई वेदर योर मार्किंग has a reaction, it has increased in size or it has reduced in size or it has got some reaction or change of the color. So the route is intradermal. When a drug is administered through the layers of skin into areolar tissue, this is known as intradermal administration, intra-arterial administration, subcutaneous administration, or intramuscular administration. So the answer is subcutaneous administration of the drug. In order to administer a drug safely, the nurse should know to read which of the following fact in the drug order: name of the patient and name of the drug, dosage of the drug and the route of the administration, date and signature of the physician, या all above. See, यहाँ पे देखिए all the points are important. You are supposed to see the name of the patient, the name of the drug, the dose of the drug, the route of the drug, date and signature of the physician on the order, right patient, right route, right drug, है ना. So these are right prescription. All these things you are supposed to see. The answer will be all above. Which of the following statement regarding drug administration is correct? When drug is administered by injection, there is a very rapid response of drug. By parenteral route, the drug go directly into the blood, so no absorption is required. The parenteral route can be used in case of a unconscious patient. And the last is all above. Here the answer is all above. So all the statements are correct regarding drug administration. Regarding drug administration, which of the following statement is correct? See, the child dose is less in comparison to the adult dose. The administration of drugs to female patient, the factor like pregnancy, lactation, menstruation to be considered. There are 5 rights: right patient, right drug, right route, right time, right method. Ensure safety in the drugs, and all above. See, here also the answer will be all above. These all are the important factors in the administration of drug. Now, drug used to relieve pain are called as antipyretics and analgesics, antibiotics, or antipruritics. See, the answer is analgesics. Analgesics are the drugs which give relief for the pain. Drug which help in reducing fever are called as analgesics, anti-inflammatory, antipyretics, or antiseptic. See, the answer is antipyretic. Pyrexia word is used for fever, and medication used to reduce pyrexia or fever is called as antipyretics. The drugs used to prevent or treat convulsion in an epileptic patient is antihistamine, anticoagulant, and anesthetic और एंटीकन्वल्सेंट. सी, एपिलेप्टिक पेशेंट मतलब कि जिस पेशेंट को कन्वर्जन्स आ रहे हैं और सीजर्स आ रहे हैं, तो वट ड्रग्स यू विल गिव एंटी एपिलेप्टिक और एंटी कन्वल्सेंट ड्रग्स. सी, द आंसर इज एंटी कन्वल्सेंट्स. सब्सटेंस यूज टू काउंटर एक्ट द इफेक्ट ऑफ पॉइजन आर कॉल्ड एज. देखो, जब भी कोई भी दवाई है उसके एक्शन को रिवर्स करना है, काउंटर एक्ट करना है या बिल्कुल मारना है, उसके इफेक्ट को दबाना है, तो वी आर सपोज टू गिव द ड्रग. उसको क्या बोलते हैं, तो उसकी ब्रॉड क्लासिफिकेशन क्या है? एंटीट्यूसिव, एंटीडोट्स, एंटी इन्फ्लामेटरी, एनेस्थेटिक्स. सी, द आंसर इज एंटीडोट्स. जब भी हमें किसी चीज़ का तोड़ चाहिए तो हम बोलते नहीं इसका एंटीडोट क्या होगा. तो सेम वे द काउंटर एक्ट द पॉइजन इफेक्ट दैट इज कॉल्ड एज एंटीडोट. The drug used to destroy and expel worms are called as antibiotics, anti-inflammatory, anti-helminthics, antipruritics. See, antibiotics are the drugs which are derived from the microorganism for to kill the bacteria, क्योंकि उसकी minor effect को लेके उसकी हमारी body antibiotic produce करती है उस antigen sensitivity से. So these are antibiotics. Anti-inflammatory क्या होता है, जो inflammation को कम करते हैं. और antipruritic क्या होता है, pruritis मतलब कि खुजली होना या एलर्जी होना, तो antipruritics हो गए. Anti-helminthics, helminthics words is used for worms, and anti-helminthic will be the answer where the drug is used to destroy or expel the worms, that is called as anti-helminthics. A drug that relieves itching is called as antiseptic, antipruritic, anti-infective, anti-inflammatory. See, the answer is pruritis word ही itching के लिए use होता है, तो answer will be antipruritic. Drugs which are used to prevent or relieve nausea or vomiting. Nausea होता है और vomiting का मतलब होता है, nausea मतलब feel कि उल्टी आने वाली है, ऐसे फीलिंग हो रही है गंदी सी, और vomiting मतलब vomiting उल्टी हो ही रही है. So emetics, एंटी-एमेटिक्स, एंटी डायरेटिक्स एंड स्टीरॉइड्स. सी, एमेटिक्स का मतलब बोलता है उल्टियाँ करने के लिए दवाई, एंटी-एमेटिक्स का मतलब होता है बंद करने के लिए दवाई, एंटी डायरेटिक्स मतलब कि डायरिया लूज मोशन बंद करने के लिए, और स्टीरॉइड्स आर ऑल टुगेदर अ वेरी डिफरेंट classification of drugs. So answer will be anti-emetics. An agent used to increase the level of hemoglobin content in the blood is called as hematinics, हेमोस्टैटिक्स, ऑक्सीटोसिन होगा बेसिकली यहाँ पे, एंड ऑल अबव. सी, द आंसर विल बी hematinics. Drug used to increase the urine output are called antihypertensive and diuretics, antidiuretic hormone, and none of the above. See, drug which is used to increase the urine output increase करनी है. देखो मोस्टली किस केसेस में होती है यूरिन आउटपुट इंक्रीज करना, किस में करना चाहते हो आप, जहाँ पे कंजस्टिव हार्ट फेलियर होता है या फ्लूइड ओवरलोड हो रहा है, तो आपको पेशेंट का यूरिन निकालना है बिकॉज हार्ट पे लोड पड़ रहा है, बॉडी की वॉल्यूम अननेसेसरली इंक्रीज हो रही है. सो व्हाट आर यू सपोज टू गिव, यू आर सपोज टू, एंटी हाइपरटेंसिव्स आर फॉर ब्लड प्रेशर, टू रिड्यूस द ब्लड प्रेशर, डायूरेटिक्स टू प्रोड्यूस यूरिन, एंड एंटी डायूरेटिक हार्मोन जो होता है जो रोकता है, तो डायूरेसिस का इफेक्ट. तो डायूरेसिस का मतलब ही होता है यूरिन प्रोडक्शन, तो ड्रग्स का नाम विल बी डायूरेटिक्स. डायूरेटिक्स के एग्जांपल्स हैं जैसे लेसिलेक्टॉन एंड लैसिक्स, है ना, फ्रूजिमाइड. These are all examples. Drugs which dilate the blood vessels and used to lower the blood pressure. What are the drugs which dilate the blood vessels? They are dilators. So vasodilators, vasoconstrictors, mydriatics and myotics. So answer is very clear. Vasodilators, जैसे nitroglycerin is a vasodilator. Cardiotonics are the drugs used to treat dysarrhythmias, treat inflammatory diseases of heart, increase the heart rate and cardiac muscle contraction, and all of the above. So increasing the heart rate and the cardiac muscle contraction, it increases the heart rate and increases the cardiac muscle contraction. They are called as cardiotonics. Anxiolytics are the drugs used to treat depression, to relieve anxiety, to induce sleep. None of the above. See, anxiolytics are actually meant to relieve anxiety. Mydriatics are the drugs which constrict the pupil of the eye, dilate the pupil of the eye, dilate the blood vessels, contracts the blood vessels. Now answer is it dilates the pupil of the eye. Like for example, tropicamides eye drop, या these are the dilator, pupil dilate हो जाते हैं. Atropine or tropicamide eye drop, these are all will dilate the eye pupils. Myotics are the drugs which constrict the pupil of the eye, constrict the blood vessel, dilate the blood vessel, dilate the pupil of the eye. Constrict the pupil of the eye. So the action of myotics are constricting the pupil of the eye. Now hypnotics are the drugs which relieve anxiety, induce sleep, reduce muscle tone and causes muscle relaxation, or the all of the above. See, the hypnotics are the drugs that induce induce sleep. Galactogog is the drug which increases breast milk secretion, increase food glucose levels, decreases blood glucose level, increases appetite. See, galactogog are actually word used for the food item or the drug which increases the production of breast milk. So for example shadavari powder, for example some of the tablets like हम लोग डोमस्टैल वगैरह भी देते हैं पेशेंट को, या पेरिनॉम देते हैं फॉर इंक्रीज प्रोडक्शन ऑफ ब्रेस्ट मिल्क. सो गैलेक्टोगॉग आर द ड्रग विच इंक्रीजेज द ब्रेस्ट मिल्क सिक्रीशन. Which vitamin is also known as anti-sterility vitamin? See, vitamin C, vitamin E, vitamin K, vitamin A. See, the answer is vitamin E. Vitamin E is also known as the anti-sterility vitamin. ये ना reproductive organ की growth में develop में help करता है. In the following, which is the advantage of intravenous drug administration? Useful in emergency condition. Large volume of solution can be introduced. This is a very rapid response of the drug. There will be a very rapid response of the drug when you administer a drug in intravenous route. So ये सारी ही options जो हैं वो बिल्कुल fit बैठ रही हैं in the advantage of intravenous drug administration. So here the answer is all above. In intra-articular route of the drug administered injection given into arteries, joints, areolar tissue, and B option will be veins. So intra-articular route of the drug is joints, क्योंकि आर्टिकुलेटिंग जॉइंट्स होते हैं, जो एक जॉइंट दूसरे जॉइंट से जुड़ता है ना, तो उसको कहते हैं आर्टिकुलेशन. सो द ड्रग्स विच आर इंट्रोड्यूस्ड इंट्रा आर्टिकुलर इज कॉल्ड एज द ड्रग्स विच आर गिवन इन द जॉइंट्स. फॉर एग्जाम्पल, in knee joint, when a patient is having pain, we give injection in the knee joint, so that the patient can have relief from the pain. Joint तो the intra articular joints में जब आप injections देते हो, they are actually given in the joints and not in the arteries or veins or areolar tissue. In the following, which is the disadvantage of IV route? Now here we are talking about the disadvantage कि इसका फायदा नहीं है. If excess dose once injected, the drug cannot be taken back. Only trained person can use this method. Possibility of introduction of injection and infection and all above. So ये जो in the following, what these are actually all the disadvantages. If excess dose once injected, you cannot withdraw back the injection, and only trained person can use the intravenous route of drug administration. Possibility of introduction of infection definitely into the IV route due to contaminated procedure. So answer will be all above. And I also want to tell you, when a trained person can use this method means that trained licensed person, for example a nurse is a licensed trained person, she has got a registration in the state for practicing her nursing, and that is why it is called trained person. And same way, injection cannot, once given, cannot be withdrawn because it has already gone inside the blood and gone and got absorbed. Possibility of introducing infection means that when you are doing a procedure in a contaminated way, so if a person is not trained and skilled, they will definitely give contamination through intravenous route, and intravenous infection can lead to septicemia, can lead to infection to the various part of the body, because blood stream is connected throughout the body, and heart में जब पूरा infection जाता है तो वो वैसे ही पूरी body में फैल जाता है. So the answer is all above. In an unconscious patient, which is the preferred route of drug administration? देखो, in unconscious patient है, आप उसको oral injection नहीं दे सकते, inhalation नहीं दे सकते, anteral route नहीं दे सकते. एंट्रल मतलब थ्रू मुंह से खिलाना या राइल्स ट्यूब से पेट में डालना. सो इंट्रावीनस, येस यू कैन गिव. द आंसर इज इंट्रावीनस रूट. विच ऑफ द फॉलोइंग इज अ कॉम्प्लिकेशन ऑफ इंजेक्शन? इन्फेक्शन, पायरोजन रिएक्शन, tissue trauma, all above. See, answer is all above, because when you are giving infection, you can when you are giving injection, you can give infection, you can give patient को pyrogen मतलब कि बैक्टीरियल इन्फेक्शन का रिएक्शन हो सकता है, और जब आपने इंट्राकैथ लगाया है तो वहाँ पे टिश्यू ट्रॉमा होगा, फ्लेबाइटिस हो सकता है, थ्रोम्बोफ्लेबाइटिस हो सकता है, वहाँ पे गैंग्रीन बन सकता है. तो आंसर विल बी ऑल अबव. Repeated injections on the same spot can cause induration of the skin and scar formation, injury to the nerves, injury to the walls of the blood vessels. The answer is all above. Very clearly here the answer will be all above. Selection of the site of the patient depends upon route ordered by the physician, the quantity of medication to be given, the characteristics of the medication to be given, all above. See here the answer is all above क्योंकि route ordered by physician is important, the quantity of medication to be given is also important, it is the part of the order of the physician, and characteristics of medication to be given, some drugs are only meant to be given IV, so answer will be all above. 5% glucose saline means each 100 ml contains 5 gram glucose and 5 grams of sodium chloride. Each 100 ml contains 5 gram of glucose and 0.9 grams of sodium chloride. Each 100 ml contains 5 gram of glucose and 0.45 grams of sodium chloride. Each 100 ml contains 0.5 grams of glucose and 0.9 grams of sodium chloride. See here, the answer is each 100 ml contains 5 grams of glucose and 0.9 grams of sodium chloride. I will repeat the answer again. 100 ml में 5 grams of glucose and 0.9 grams of sodium chloride. This is 5% glucose saline. And if the concentration is not 0.95 grams and it is 0.45, then it becomes 5% glucose half saline. Before giving an injection, the nurse should be able to select equipment appropriately, select the site quickly and accurately to prepare the medication as desired, and all above. See very clearly the answer is all above. Whenever you're going for a procedure, you are supposed to select an equipment, appropriate equipment. कि आपको IV set चाहिए, IV bottle चाहिए, pedia drip चाहिए, burette चाहिए. Select the site. Patient की body पे site आपने quickly select कर ली और accurately select कर ली कि आप यहाँ intracath लगाओगे, आपको बिल्कुल यहाँ पे surely मिल जाएगा. And to prepare the medication as desired, कि अगर आप कोई इंजेक्शन देने वाले हो, आपने उसको प्रॉपरली डिजॉल्व कर लिया, एक्सपायरी पढ़ लिया, रेट पढ़ लिया, किस रेट पे देना चाहते हो, इन्फ्यूजन में दे रहे हो या डायरेक्ट दे रहे हो या ब्यूरेट में दे रहे हो या इन्फ्यूजन पम्प में दे रहे हो, तो दैट आंसर इज ऑल अबव. Which of the following is the advantage of plastic syringe? The plastic syringes are disposable and cheaper. The plastic syringes do not break easily. There is a decreased risk of air embolism. All above. See, answer is all above. The plastic syringes are disposable and cheaper. The plastic syringes do not break like glass syringes. When you use a single syringe for a patient, then sterility automatically increases, and there is a very decreased chances of air bubble, because you can always manipulate and the air bubble goes up, and then you can remove the air bubble from the syringe. See, answer is all above. In the following, which factor should be considered in the selection of syringes and needles? The route ordered, viscosity of the medication solution, amount of medication to be administered, all above. See, answer is all above, because whenever you are selecting a drug, the route ordered is important. If you are giving IM, IV, subcutaneous, intradermal, viscosity of the drug solution की क्या viscosity है, कई oily preparation होते हैं, कई non-oily preparations होते हैं, कई fluid has to be made in the 5% dextrose, some fluid injections has to be dissolved in the normal saline, some has to dissolve in the distilled water, so there are so many viscosity of the drug depends upon that, and amount of medication to be given, आपको कितना देना है, आपको 100 ml देना है, आपको 5 ml देना है, आपको 10 ml देना है, आपको 2 ml देना है, so factors are all above. Which of the following is not a part of a syringe? See, barrel, plunger or a piston, shaft, none of the above. See here, the shaft word is never used in a syringe. The barrel, the plunger or a piston is the part of the syringe, and the shaft word is actually used for the length of the instrument, not in the syringe or the needle. सी नाउ द प्लंजर और द पिस्टन वर्ड इज़ यूज फॉर द सिरिंज. जब आप उसकी जो विड्रॉ करने वाला, जो एस्पिरेट करने वाला जो प्लंजर होता है, वो पिस्टन, उसको पिस्टन कहते हैं. और बैरल इज़ अ सिलेंड्रिकल पोर्शन दैट ऑफ अ सिरिंज और अ नीडल. सो शैफ्ट वर्ड इज़ नॉट यूज इन सिरिंज, सो आंसर इज शैफ्ट. In selecting the needle, the nurse should see that the bevel should be sharp and without hooks. कई बार क्या होता है, बेवल ट्विस्ट हो जाता है, टर्न हो जाता है, तो बेवल शुड बी शार्प सो दैट व्हेन यू पंचर द स्किन इट शुड बी इजीली गोइंग इनसाइड एंड देयर शुड नॉट बी एनी रेजिस्टेंस, बिकॉज देन टिश्यू ट्रॉमा हो जाता है. Needle size should be smallest gauze, appropriate for medication. Now, depending upon what injections you are giving, needle size should be smallest. Now, needle should be fit tightly to the syringes. नहीं तो कई बार क्या होता है, जब आप जैसे इंजेक्ट करने लगते हो, needle और syringe डिस्कनेक्ट हो जाती है और पिचकारी लग जाती है. So, इसमें आंसर होगा, in selecting the needle, the nurse should see that all above factor A, B, C, all above factor should be seen. Which fact is true about paracetamol? It is an analgesic and antipyretic drug. It has a weak anti-inflammatory property and it is a hepatotoxic in large doses. Now about paracetamol, देखो it is, yes, it has got analgesic property and it has got antipyretic property. Pyrexia word यूज होता है फीवर के लिए, तो एंटीपायरेटिक प्रॉपर्टी उसमें होती है। और जब आपको कई बार हेडेक होता है तब भी आप खाते हो, तो सर दर्द या पेन के लिए भी आप एनाल्जेसिक के रूप में भी पैरासीटामोल को खाते हो। उसमें एंटी इन्फ्लामेटरी प्रॉपर्टी नहीं होती है, एंटी इन्फ्लामेटरी प्रॉपर्टी होती है ब्रूफिन में या इंडोसिन में या सिराशियोपेप्टिडेस वगैरह में। सो इन्फ्लामेटरी प्रॉपर्टी वीक होती है। और हिपैटोटॉक्सिक मतलब इन लार्ज क्वांटिटी इफ इट इज़ कंज्यूम इट इज़ हार्मफुल फॉर द लिवर. So the fact which is true about paracetamol are the all three factors, and I want to tell you what is the antidote of paracetamol. N-acetylcysteine is the antidote of the paracetamol. So the facts true about paracetamol are all above. Now 5% dextrose in a normal saline is isotonic fluid, hypotonic fluid, hypertonic fluid, none of the above. See, the answer will be hypertonic fluid. Which of the following statement is not true about aspirin? Acetyl salicylic acid. Which of the following statement is not true about aspirin? So now aspirin. Aspirin has analgesic, antipyretic and anti-inflammatory action. Aspirin can cause gastric ulcers and GI bleeding. Aspirin increases platelet aggregation and help in blood coagulation. Aspirin provides symptomatic relief in rheumatoid arthritis. See here, the answer will be aspirin increase platelet aggregation and help in the blood coagulation. तो पूछा गया है which statement is not true. तो basically aspirin decreases the platelet aggregation and helps and do not and prevent blood coagulation is the true statement. So इसमें ऑप्शन है aspirin increases the platelet aggregation, so ये not true है, and help in blood coagulation ये भी not true है. So answer is this. Thank you viewers, like, subscribe and share. Thank you so much.